shoulder surgery, we typically will place you in a sling with a pillow such as you see here, and I get a lot of questions afterwards as to where to position the sling, how it should be adjusted for the most comfort but also to be the most supportive for the shoulder. And so I wanted to give you a demonstration as to where I think it should be worn and how it can be taken on and off safely to give you some ideas of techniques that might assist you. So in general, after shoulder surgery, I like the sling to be positioned on the patient's side as opposed to having it be worn across the front like this. So I think it makes it easier to recover post-operative range of motion if it's worn over here on the side. Generally, the strap should be tightened to where it's supportive, to where you feel like the sling apparatus allows you to relax into the sling and take the weight off of the shoulder. And this particular sling that I've selected for my patients is designed, it's a little more complicated, but it's designed such that it takes the stress of a strap off of your neck. By virtue of having the shoulder strap sling underneath your arm and over your arm, it takes the strap away from cutting across your neck. So it seems slightly more complicated, but once you get used to it, I think you'll find that's fairly comfortable and effective support. So there are several unique features to the sling which I believe are helpful to the patient. Number one is this pad is designed to accommodate the side nicely. It's fairly form-fitting, and it serves to elevate the arm just off the side to take the stress off of the rotator cuff. The second is this hand pad that you can see. It's useful for giving the hand some exercise and utilizing the forearm muscles, and this is a safe activity anytime. I do like patients to pay particular attention that the straps here and down here are not cutting into too hard onto your skin. So particularly the first day or two after your surgery, frequently check and make sure that these straps are not cutting too hard against the skin. We would not want that to cut the circulation off to the finger or the thumb. And this can be adjusted with a simple tensioning device right here. Okay, so that would make it relaxed such that that could be pulled away, and then that could be tightened and like such. This strap here just serves to kind of keep the arm tucked in. There's the single shoulder strap that we discussed. You can see how there's one strap that goes under the armpit and one that goes across the top of the shoulder. I recommend that once we have the tension adjusted, that you just use the buckles to get in and out of your sling, as opposed to using the Velcro tabs here and here, because then you'll have to reset your tensioning. And then finally there's the waist strap here that comes around the waist and buckles here to help keep the pillow adjacent to your side. I think it's important to pay attention to the technique that we use to take the sling off. After some shoulder surgery, for example after rotator cuff repair, I prefer that the operative arm is not actively raised away from the side, and there may be a tendency to use that type of action when you're taking your sling off. And so I'd like to demonstrate that when you take the sling off, you basically lean toward your operative arm. So I recommend that you undo the buckles, slip your non-operative arm out of the sling, and then lean towards the sling and let your arm hang freely, and then slide the sling off while you're in that hanging position. Bring the arm back to your side, and then you can stand back up. And that's the best and the safest way to remove the sling after a repair. One of the most difficult aspects of using a sling after surgery is effectively putting the sling on by yourself. It's nice the first few days or even a week if you have a family member who can assist you putting on a sling, but there are times where you'll be in a situation where you need to be able to put the sling on safely by yourself. I recommend you set the sling up on a countertop or on a table in advance. Position the straps as you see here and have the top of the sling open. And again, the idea that I have is to try to avoid raising the operative arm out to the side. So I prefer you not to raise the arm up and try and position the sling to you, but rather to lean over, let gravity hang your arm from your side and get the sling on. And that's what I'll demonstrate. So what I think is the most effective is have it positioned like this. Slide, keeping the arm by your side, slide into the sling like this. Then reach around and grab the waist strap. You can usually use your opposite hand to help with the buckle, like that. And then reach over. Bring the strap over your shoulder, and then slide your hand up through the two straps, and then bring the buckle over and reconnect the buckle like that. I've spent a good deal of time trying to educate the perioperative nurses at the hospitals and the surgical centers as to how to apply the sling apparatus that I use. And because it's a little more complicated, without fail, there are times where patients go home with the sling inappropriately applied, and so I wanted to demonstrate what I see as a mistake. And that would be the first mistake I see being two straps over the shoulder and the straps riding up on the neck. And so that's the first mistake, and can be corrected by slipping the arm between the two straps like so. The next thing that happens is the sling may not be adjusted perfectly, and you may find that your arm is not being well enough supported, that it's not doing an adequate job of supporting the arm, such that you can relax your operative arm into the sling. And in this scenario, it will need to be adjusted in terms of the tensioning. And so we'll demonstrate that. So each of those 4 adjustments can be used to retension the straps so that you have appropriate support for your arm and for comfort.